You're listening to Telling New Kinds of Global Health Stories, a Pulitzer Center webinar. All right. Thank you all again for joining us today. Before we begin, I have a couple of clarifications. As a person who kind of architected the title, telling new kinds of global health, public health stories does not necessarily mean like new, like that they're the first of their kind, these stories, but they are among, in my mind, the first to follow. Some of the first to follow the COVID-19 pandemic and kind of the information swirl that it was, as well as, of course, a national catastrophe or international catastrophe. So we've decided, in addition, instead of reporting or journalism, to kind of expand the definition a little bit to stories, just to broaden public health's narrative mandate here, because it really is something that tracks across genre. So I'm really eager to get into this conversation. I'm going to begin with a short introduction of everybody here so I can stop talking. My initial questions will hopefully allow you to elaborate on your biography and your work in your own words. So Buki Adebayo is a correspondent for Thomson Reuters Foundation and Context Newsroom. She's reported on health, gender, and political issues across several African countries for media organizations, including CNN. She is also taught at the Harvard Division of Continuing Education and is a 2021 Nieman Fellow at Harvard University. Jason McClure is a correspondent for The Examination, a startup investigative news nonprofit focused on public health and corporate accountability. McClure has taught journalism at the University of Missouri, reported politics for Reuters, worked as an Africa correspondent for Bloomberg, and served in the U.S. Peace Corps in Niger. Mahima Jain is an independent multimedia journalist writing at the intersection of health, gender, and the environment, based in Bengaluru, India. Her features, long-form stories, and podcasts have appeared in Indian and global media outlets, including Hakai Magazine, The Guardian, Scroll In, BBC, Foreign Policy, The Caravan Magazine, and The Fuller Project. Buki, I'm going to begin with you because of, we're going alphabetically here. You've reported with us before and after the pandemic. So my question is, it's actually a compound, but what were your projects before and after? And how have you noticed kind of the ambient environment and relationship to your public health storytelling change? What do you think the role, your role is now as opposed to what it was in 2019?
Yeah, thank you for that lovely introduction. I would say I've been a health journalist all my life. I've branched out to reporting other things, but I was a local reporter in a local newspaper in Nigeria. I was a health editor. And it would take so much to put a health story on the cover of the newspaper way back then. Politics, all other form of reporting dominated the front cover, the front page or online of the newspaper. And it would only require maybe an outbreak. I remember the Ebola outbreak in West Africa that trickled down to many countries, Sierra Leone, Liberia, and Nigeria. That was the only time you would get like a story of public health importance for the editors to sit up and listen. And I always wondered what will it take to get everyone to sit up about how, not just when you're talking about pandemics, epidemics, an outbreak, how public health affects us every day. And what I would say is, fast forward now to when there was when we had the pandemic, when there were lockdowns and all that, and now you have public health stories around health. Editors are more willing to platform stories around health. The Washington Post has had a section on first-person narrative around people that suffered from COVID or had long-term COVID. You have more resources. You have more visibility around stories that have to do with public health. And even when you're talking about climate change, you're talking about public health. When you're talking about economics, you're still talking about how does this matter to the health of the people. You're talking about the budgets, health budgets. You're talking about how ministries of health are sort of positioning themselves to public health issues. That's what editors are asking you about data around public health. I think that's what I've seen that's changed. There's more interest in the media. There's more appetite for this kind of storytelling. And I recently just wrote a story about how pollution in a community in Nigeria had gone on for 30 years. And I would say what really, really drove the story, it was not just about the pollution, it wasn't the environmental disaster, it wasn't the fact that water had been polluted for 30 years and people couldn't drink safe water. It was about how has this affected the health of the people, and that mattered, and that was what could hold the government accountable. Unlike before, it would have been just about the environmental impact or the pollution this has caused. I would say before the pandemic and now, I would say there's more interest for more evidence-based journalism around health. It's not just about, say, somebody suffered this and that, or a community is impacted by this, or this drug is not available or not. It's about what does this mean to the global supply chain of bedaquiline that is being used to treat TB? What does malaria vaccine? What does the supply chain? If this is not available in Africa, what does it also mean for people in Asia, in other parts of the world? So it's become a more global conversation. It's become a conversation that more people are willing to listen, and more newsrooms are willing to dedicate resources to that and platforms. So I hope I sort of answered that question there.
No, that was great. Thank you, Buki. And we'll touch on. I have a question later. I hope to ask kind of about these cross-cutting, right, like structural interests, like how that's changed. But the last component of the question, and I think it's the hardest one. But what do you think your role as a public health storyteller is in late 2023? And this is not something you have to have something definitive to answer for that.
I think more and more, I'm just more aware of how much more with more interest is more responsibility, right? You need to you need to be more sensitive about your narrative. You need to be much more sensitive about the way you shape your storytelling. You need to make it digestible. Before, a lot of health reporting was just sectioned and all that, but now you have a wider audience. You need to bring your readers down to it. You need to make it count, meaning you touch on a story and you also want to follow it up because you just don't know. I mean, whoever the reporters that reported on the initial outbreaks of COVID, they probably didn't know that this was something that was going to affect the world. So I guess more and more, I see myself telling a story, not just about a community, not just about a country, but something that anywhere in the world could matter to them, wherever they are, because you just don't know how far public health issues travel.
Yeah, the long tail, that's fascinating, and that is a big responsibility. Jason, did you came off mute? My next question is for you, but did you want to respond to Buki?
No, I mean, I concur with everything that Buki said, and I would just say that, it's an honor to be here. It's an honor to be on a panel with Buki and Mahima, who are two really distinguished journalists. But I think for me, I would just add to what she said is that I think the pandemic really highlighted the stakes for health reporting. And I think as it relates to news, and it also highlighted the fact that disinformation has become such a huge global problem. And it doesn't just affect health issues, it affects all sorts of different issues, but it was really, really brought into focus, I thought, during the pandemic, where we saw that large shares of the population in many countries didn't want to get vaccinated, didn't want to wear masks, didn't want to take other sort of basic health steps. And, I'm sure going forward that the same ecosystem is going to lead to similar problems with different types of public health problems going forward. And that's a major issue for policymakers, huge issue for us in the media as well. So I would think, to me, that's one of the things that the pandemic really highlighted in terms of health reporting.
Well, and you certainly faced your fair share of misinformation in your project, which examined the Chinese state tobacco company's role in shaping health policy in China. My question is, how did you arrive at your provocative title, like "Smoking for the State"? like where along the line did buying cigarettes turn into like a political priority? And why is that so dangerous insofar as like these spurious narratives go?
Yeah, that's a good question. And thanks again to the Pulitzer Center for helping to fund this project. But at the examination, along with our other partner media organizations, both in China and Germany, we really wanted to focus on China's government-owned tobacco company, because the fact that the Chinese state owns the world's largest cigarette company is an enormous conflict of interest. And this cigarette company has great influence over China's health policies and its smoking policies specifically, which of course helps explain why China has had a fairly poor record in cutting smoking. But I would also point out that government-owned tobacco companies, they're nothing new. There's still about 20 or so in the world today, depending on how you count this. And these are institutions that go back centuries in many cases, and have a lot to do with how governments taxed their people. Of course, several hundred years ago, you didn't fill out a form or submit it online to pay taxes. And so what governments found was that one of the easiest ways to raise money from their population was to tax a good that everybody wanted, or lots of people wanted and consumed. So salt is one of them, but tobacco was another. And so a number of governments, including China, many in Europe, different parts of Africa, the Middle East, set up these state-owned tobacco monopolies to control the tobacco trade, and that's how they raised money. And that worked fine until about the 1950s or 60s, when it really became clear that tobacco was causing a massive public health crisis all around the world. And many countries began to sort of separate the government's interest in selling tobacco from the public health concerns that it causes, by privatizing the companies, or in some cases sort of trying to wall them off from influencing policymakers. Unfortunately, in China, we haven't seen that has really happened. And as a result, this state-owned cigarette company still has enormous influence over how China makes its health policies.
Thank you, Jason. Yeah, it was a really excellent story, and the graphics in particular. That's a question I'd like to get to later as well. Speaking about multimedia, my next question is for you, Mahima. You've spent a lot of your career looking at health through a gendered lens, and your latest center-supported pieces addressing gender-based violence in India are excellent. They're both thorough, and they're really thoroughly disturbing as well. Can you describe why you choose to look at health through a gendered lens, and not the other way around, gender through a health lens?
Well, the short answer is because I wanted to kind of look at more of the health aspects rather than just the gender aspects, which are spoken about a lot in India. But it was honestly just about the starting point of those pieces. The main focus, so my project was called it's still ongoing, India's struggle towards healthcare for survivors of gender-based violence. And India is infamous for having really high levels of violence, crimes against women. And it all kind of became very global and very graphic about 11 years ago, when the Delhi gang rape happened, where Jyoti Singh was brutally attacked and then raped and murdered on a moving bus in Delhi. So after that, the conversations in India have often been about looking at gender-based violence from a criminal justice perspective. My question was, how do we bring the focus on the survivors of violence and not the perpetrators of violence alone? That is important, but what about the needs of the survivors? And that's where I started looking at this issue, and it just emerged from my conversations with doctors, through my reporting, that there is just a staggering amount of health issues that women face purely because of the various kinds of violence they face across the country. And we now know through data that only about 1 or 2% of the cases are even reported as crimes. So the numbers are really just too high for us to even imagine. And what I learned was that healthcare was perhaps one place where survivors were going to seek help, but not disclosing the violence. And that's what the project looked at. And just to add on to what Buki was saying earlier about how COVID changed the, the narrative of how health stories are reported, one of the things that kind of happened was also, she spoke about it, like we looked at supply chains, and we started basically looking at systems. And this happened in the pandemic as well, when India was talking about a silent pandemic of violence against women. It was a very big problem in India because women were basically trapped with their abusers. That's family members, fathers, husbands, sons, partners, whatever. And so then you look at where they are going and what the systems are doing to help them. And we found out very, very quickly that we didn't have any systems in place. So yeah.
Thank you. Yeah, and I'm curious. You're bringing up, people often very vulnerable, people's contact with systems. Which at least in the States, there's been a lot of reporting how damaging that can be. But it also can be restorative, to your point. And I think my question is, as a journalist, it's really hard to access those spaces, and particularly to talk to people. And I know all of you, right, are reporting issues that, either in Jason's case, the state doesn't want you to report. In Hima's case, it's culturally taboo. And in Buki's case, right, like, is like the land is treated as not, of the people who live on it, right? So like, how do you? I guess my first question is, how do you? And I'll stop here. But how do you reach these people? Like, how and communicate with them and tell their story accurately, or as they would perhaps want to see it presented, as much as that's possible? And I can start with Mahima, because you were just speaking, but this is for all of you.
Right. So in the stories that I did for the recent project, I spoke to both survivors of violence as well as practitioners, healthcare practitioners. And I think even those, healthcare practitioners also often don't find their experiences reported in the media. We often go to them as experts, but not kind of understanding how they implement policies or how the policies affect their practices. So I think one of the things I found was doctors and nurses and hospital staff were hesitant, but they were willing to speak to kind of shed light on what, for example, an kind of paperwork does to their routine, when or how it complicates their relationship with the patient, for example. As for the survivors, one thing I've realized is to kind of go through people they trust, which might be like nonprofits or doctors, if they're willing to share, or circles where they are supported, and kind of always keep kind of be gentle and kind with them and follow all the ethical guidelines that we all have out there, to make sure that they are not re-victimized in any way. Because I was speaking to a lot of women, and I figured that, women do want to be heard. A lot of these women have not spoken about their experiences out in public, or they've not even had the opportunity to share it with their own family members because they may be hiding it from them. So oftentimes they do want to share. It's all about like, how open are you to listen to them and kind of place it in the story for everyone to hear.
I just wanted to chime into what Mahima has just said. And it's been a mixed sort of reaction for me, whereby before it used to be take a lot of convincing to tell people to share their experiences, especially about health. I remember I was at CNN then at the early days of COVID, where we would reach out to people that we knew personally one way or the other, that had been that they are tested positive to COVID, and they were reluctant to share their stories because of the stigma. Nobody knew how this was how infectious this was, apart from the science community, and they were reluctant. But I think with more stories out there, they became more open. You would see people share it, because now they are worried about getting tested. They are worried about isolation. They are worried about whether they would get, there was no treatment for it at the time. So I feel like more and more, I've seen more people willing to share their stories, more people willing to get intimate with you in terms of how they narrate this. And the last 2 stories I've written is about how people, funny enough, is about land and how human activities have sort of made land more problematic for the people that live there. And initially, they would have, this is a story that I've been working on for 2 years. They were reluctant to talk to me. But I think we're more convincing that this is a project that I'm not just going to stay, or I'm not just going to report out and leave it. I'm going to follow it up. There's interest. This has been supported by the Pulitzer Center. This has been supported by my organization. I'm invested in this story. We will follow up, and also seeing how much effort has gone into trying to get the government to respond to something. So before, I would just go to the newsroom, say, oh, I've reached out to the government, I'm talking to my editor. But this time around, I was telling the people that I was reporting on, I've reached out to the Ministry of Health, I've reached out to the Ministry of Environment, the water agencies, and this is the response I'm getting from them. This is the response I'm not getting from them. I feel like they felt more invested in the storytelling process, not like they saw a copy or anything, but I also think like the two-way conversation sort of made them open up, also knowing that this is something that they could also contribute to one way or the other, just also helped them. And I think that's just sort of made it easier for them to just share their stories. And those that were wary said, okay, you know what, we'll give it another try and see what happens with this form of storytelling. Yeah, that I would say that's been my experience lately. Yeah.
Yeah, I would just jump in on that, and I think Buki deserves a lot of credit for really getting close to the people affected by the issues in Lagos, and she really brings that out in her reporting because I think you really feel a stronger sense of the problem and the issue when you hear it through their voices. Now, in terms of our story on China tobacco, it's almost the exact opposite, because China is an extremely, extremely restrictive media environment. And so I think if you were to read our stories next to each other, you would see that she is so much closer to the problem and to the people affected than we were. And that's really a function, I think, of the different media environments between Nigeria and in China. China ranks 179th out of 180 countries on Reporters Without Borders World Press Freedom Index this year. So it's ahead of only North Korea. And so for us, and so I worked on a team with reporters from Der Spiegel, from Initium Media. There must have been 4 or 5 of us working on this story at some times, and there were over 300 million smokers in China. It was a huge struggle for us to interview just 1 or 2 there, right? It's something as seemingly innocuous as smoking, and that really speaks to people's fear about speaking to foreigners, about speaking to independent media there right now. And it was a big struggle, because my editor even had a hard time understanding. He'd say, you know, there's 300 million potential people for you to talk to about smoking in China. Like, just bring me a couple. And it was a real struggle, because the foreign media in China is very much viewed in the same way as almost a foreign intelligence service, that you're treated as someone looking to undermine the government, undermine the legitimacy of the government. So in the China context, that proved extremely, extremely difficult.
Yeah, can you tell me a little bit more about that? Like, what you know, we've been tracking, right, this authoritarian shift in the past few years. It was in seeking the power, and you know, it's affected everything, even seemingly non-political aspects of life, like smoking. Can you tell us a little more about that?
Yeah, this was, I think, a revelation to me and some of the other reporters that worked on this project, was that we are approaching this as a public health story. Smoking, it's not really a huge political issue anymore in a lot of countries and in a lot of places. But because the cigarette monopoly in China accounts for about 7% of government revenues, that's basically equivalent to China's defense budget. It's $213 billion last year. It is enormously powerful within government. But sort of one of the strange things that's happened in China is, as the government has grown more authoritarian, as there have been more restrictions on civil society, this hasn't just affected sort of the political dissidents or human rights activists that you might expect. it's affected people in all different forms of civil society, including people who work on women's rights, people who work on health advocacy, people who work for anti-smoking groups, environmental groups. There's been a little bit more space for them, but it's really remarkable how even people in the tobacco control sector feel like what they can say about the government's tobacco policies, about the state monopoly, it's very, very restricted now in a way that it wasn't even 10 years ago, when you saw public interest lawyers bringing product liability lawsuits against the tobacco company, trying to hold it to account for the health damages it was causing people. Now there's really a culture of silence there. And as all the power has been concentrated centrally, it's not clear how China can address this problem, because the judiciary isn't independent, the media has been effectively silenced, civil society has been silenced. There just aren't many competing institutions that can provide a check on this problem in the way that there are in many other countries.
Thank you, Jason. And I want to kind of pull that apart too. I'm really interested in, these solutions, right, that are often, groundswell solutions, right, because you're not seeing them from governance. I know, Jason, you started the examination, to follow the long tail. Buki, you were talking about this earlier today, about how you're really interested in following, the protracted aspect of these, like what where is this going to go? Could this be? And Mahima, I know you wrote a little bit about, legislative redress in India. So how have you seen, right, institutions and governments think about or try to think about like these thin and snaking lines of causality and maybe compensate for it, right, with, whether it's a reparations program or right, like how are people thinking about that? Should governments and large organizations even be in charge of it? And this is not, necessarily a question anyone's going to have an answer to, but I'm very curious.
Sorry, I'm having a little bit audio problem. I didn't get that question.
I'm sorry, can you hear me? Can you hear me okay?
Yes, I can hear you now. Okay.
My question is how have you seen governments and organizations think about or try to think about compensation or reparation for some of these public health issues that you talked about? And should governments really like have, what's your experience been?
And I would reference the story I just reported out, where a community of more than 1 million people in Nigeria, their community had been polluted by oil, crude oil produced by the government, which, the government of Nigeria has billions of dollars from oil. Oil is like 80% of the country's revenue. And they make so much money from this, but the impact of their activities ruined water and underground water and everything in this community, whereby for more than 20 years, people spend like a quarter of their income buying water because the water that is in their community, they cannot drink it. 1 million people, that's a huge number. The government is making billions of dollars. And these people have been asking for compensation because now they're spending a lot of their income buying water. Businesses have been shut down because nobody wants to set up a business in a place where you can drink the water. People have moved out because they fell sick from drinking water that has been polluted by gas and other sorts of hydrocarbon. And they've lost a lot. Their lives is that their health is at stake, their businesses at stake, their income has been eroded by this problem that seems so little but has persisted for so long. They've been asking for clean water. They've been asking for government to compensate them for what they've lost. And the government of Nigeria has just said no. And I think that's been my experience reporting on not just pollution, on issues that have to do with public health. The government, I think, is not just the government of Nigeria. It's just what I've seen across, like what Jason has been saying, across many authoritarian governments, whereby it just sort of seems like the health of the people doesn't matter at the end of the day. But if you do the math, if people are sick, they go to the hospital more. You spend more on health budgets. You're going to spend more taking care of more people. If we, for instance, like Mahima said, if women are being gang raped and sexually violated, they go to the hospital more. Your public health systems are more overwhelmed by problems you could have prevented instead of having to compensate for. And I think and this is also to myself, I'm thinking more and more of it. How do we tell stories that make it count to the government to say that this will save you a lot of money if you tackle it? If it's more preventive than you trying to get ahead of a problem than trying to fix the problem, because even the process of fixing the problem, there are so many bureaucratic processes whereby in the case of this community that their water has been polluted, lawyers are involved. You have, it's something that could go into litigation. And all this could have been nipped in the bud if really that problem was just prevented or tackled at the very beginning. That's boils down to the topic we are talking about. It is a public health problem because it's not just about this 1 million people that can't drink water or whatever. It is about this number of people that could potentially overwhelm your health facilities because they are sick. And compensation, like I want to go back to my experience has been the government just doesn't think this is what they should get on at the moment. And it's really sad because it's beneficial for them to at the end of the day.
I'd like to just add to what Buki was saying. And she said, for the government, public health people's health doesn't matter. And it's about 1 million people in where she was reporting the area that was affected. And in India, you're talking about 50% of the population, women. And if the government really looked closely at the issue, they know that a lot of these are going to be cases of violence from within homes, which means domestic violence cases are really high, far higher, by some estimates than what we know in what the data shows. So I think the government in India, it is a public health issue in India. It has to be a public health issue. And over the years, there have been a lot of efforts by various advocacy groups to kind of make it one. And it has, after the 2012 case, the government brought out a policy for mainstreaming. They said they would bring out a policy for, gender mainstreaming healthcare in health systems, and they brought out a policy to treat survivors of sexual violence, but it still doesn't have a policy for survivors of domestic violence. And that tells you a lot about what it thinks about a family as a unit, So that's a main thing. We need a comprehensive policy. And then when you talk about one of the biggest things that happened after 2012 was the word Nirbhaya became famous, which means fearless, and the survivor of, the victim of that incident was named Nirbhaya in the media. But and they started this Nirbhaya fund, which is now in like the last several years, it has 12,000 crore rupees. And I'm just going to briefly share this with you, so you can see the amount of money they have received. Sorry. So that's about $1.2 million in since 2013, and but the amount that is utilized is only 2,521 crores. So out of 12,000 crores, the states have only utilized a fraction of that amount, and even then, very little goes to healthcare, because they just don't see it as a health issue. They are spending it on CCTV cameras, on these other projects as railway security and things like that. But they don't want to accept the fact that a lot of violence survivors are going to the hospitals, and that they need to kind of reinforce the systems in the hospitals to deal with this issue. So I think it is definitely a public health concern, and it is something that the governments need to look at. And in India, if they have the money, they just aren't directing it in the right direction.
Well, thank you. These answers are brilliant. I really appreciate you both. Before we open it up to audience questions. My last question is just about like a general balance. And I know, Jason, this is perhaps less true for the story that you were writing, but I know for Buki and Mahima, you were both interested in balancing personal stories with fact-based reporting. And I wanted to ask after how you did that, like what exactly was the balance that you found, what made sense, and I'll stop there.
I think for this and a little bit of background, I think I've spoken about this story a little in this conversation, is about pollution, how crude oil contaminated a community of 1 million people, their water resources for more than 30 years. And the story that had been told in the people happening, it just sort of went under the radar for some time. And coming to this story at this time, I thought, what will give it an edge and what will make it something that can be denied? Because if you're talking about something that has been going on for 30 years, you sort of need some evidence. And I sort of thought of it that, you know what, how about we do our own sort of investigation, apart from talking to people, this is a community that I have people that live there. I've drank the water. It tastes like fuel. It tastes like petrol. It tastes like gas. You can see that the water is polluted. But just so to sort of make it, because we also knew that the Nigerian government was going to say, okay, you know what, this happened a long time ago. It's no longer happening. That's it. And I thought, okay, what level of storytelling can we bring that would just elevate it? And we thought, okay, how about we test this water to establish that this pollution is still going on. There's still fuel, there's still petrol in this water. And this is why people can't, this is why this problem has persisted for this long. And I think that layer is not just health, bringing the science of it, taking it down to what matters. We have stories, we have the people have shared their experiences, also bringing that. Now people are going to, if you're reading the story, you're thinking, oh my God, I know that hydrocarbon is used in nail polish, is used in paint, is used in the oil industry, and that is what some people have to drink. I think that would sort of rouse another layer of emotion to the reader. It sort of also brings more accountability to the government. And I thought and that was actually in the process of trying to get the government to respond to this. What have you done? They actually said to me, who told you that this place is still being polluted? Who told you that there's still hydrocarbon? And they were going to deny it, even though their own investigators and health ministry, environment ministry have done their own investigation there. I feel like if we didn't do this testing and send it alongside the right of response, they would have denied it, and it would have been a problem that is so obvious but still being denied. That gave it a layer of evidence, and that helped the story. So I would say that that's the approach. And I think I learned that sometimes it's not just enough to have accounts of people like Jason just said about tobacco. I mean, this is a problem this is something that he said there are like 300 million, more than 300 million smokers in China. That makes you sit up. You know that now this is not just a problem that affects 1 million people. If they are taxing 300 million people to get revenue, if this is also a public health problem, the health challenges of that. So I think more and more data is important. Evidence reporting is important, and we may just have to do more when reporting out some of these stories. Yeah.
And I'd just like to quickly tell, how did I balance the personal with the evidence and facts? One thing I did was in the personal, there was a lot of what the doctors call signs and symptoms of violence, and these would be things that they observe, things like fractures, bruises, conditions like chronic infections, asthma, and why they are so much more in women. And there was, so I would have experiences of people telling us why they are facing them. And there is actually data in India from surveys which shows that, there is a disproportionate number of women who get burns in the household, who get, as compared to men. And why is it that daughters-in-law are often the ones who are burn victims in India, and things like that. So I think there was the personal, and then there was also the evidence from surveys which would kind of just tally a little, that would add to the narrative. There was also a lot about access to healthcare, and I actually had survivors who would be chaperoned by their husbands, and that's what the data tells you, that women are not allowed to go to the hospitals alone. And they would tell outside that, oh, I'm meeting the doctor, and I'd be with the doctor, and then they would talk to me. But of course, they knew they were coming to me too, because that's how secretively people had to kind of talk about their experiences of violence and about their access to healthcare as survivors of violence. So I think the personal kind of just kind of reinforced what we are finding in surveys and data in India. So I think it just became about laying it out one after the other and kind of letting it tell the story.
Yeah, I would just jump in on that too. And at the risk of sounding old-fashioned, I think the human element is absolutely central to telling great stories and to making stories really shine. And much of what we've seen in journalism over the last 20 or 25 years has been this real emphasis on the use of technology and computer-assisted reporting. The internet obviously has been an enormously powerful tool for all of us journalists. But nonetheless, I think our audiences are still fundamentally the same as they were 50 years ago, 100 years ago, even 50,000 years ago. People still want to hear stories about other people facing some sort of struggle, and they want to hear a story with a beginning, a middle, and an end, and they want to be able to relate to that. And great reporting is always going to have that. I think the stories that really stand out and really shine. And I think as journalists, sometimes we can get caught up in the data or trying to prove points or facts, or we spend a lot of time interacting with experts and people at universities and think tanks. And sometimes it almost feels like we're writing to impress them. But really the most effective journalism, I think, starts with a great story involving a person. And so I just want to call that out, because I think Mahima and Buki, they both really have that in their stories as well.
Yeah, thank you all. I'm going to open the floor up to audience questions, so please submit via the Q&A button at the bottom if you have something you'd like to ask our panelists. Our first question comes from Brian, and this one is for you, Jason. Does China's Ministry of Health have any influence at all when it's up against so many billions in revenue created by China Tobacco?
Brian, thanks. This is a really good question, and I and my colleagues spent several months exploring this precise question. And the short answer is not much. They're not completely powerless, but when you look at the different ways that that governments try to control tobacco, let's just take the warning labels on cigarette packs that everyone is aware of, right? In China, the Ministry of Health, the health experts actually don't have any control over what the messages are on those cigarette warning labels or how big they are. That's all determined by the tobacco company itself. And so, to no one's surprise, the warning labels are very vague. Many of them just say smoking is harmful to health. They're not attention grabbing. They're easy to ignore. The color schemes blend in very nicely and seamlessly with the beautiful cigarette packs that China Tobacco often produces. So effectively, I mean, the way one source described it to me is if you look at the website of China's State Council, they actually list all the different, I don't know, I think it's a couple dozen different ministries within the Chinese government. They're actually listed in order of importance. And the ministry that China Tobacco, the state tobacco monopoly, is under, I think, is ranked 3rd or 4th, and the Ministry of Health is all the way near the bottom of the list. And this isn't unique to China. I think health ministries are weak in almost every government around the world. And it very much has to do with money, right? It's the health ministry that's spending money. In the case of the Ministry of Industry or the tobacco monopoly, they're the ones generating the money, which everybody in government wants, and everybody in government likes having money to spend. So they're going to be granted wide latitude. And so it's a real challenge in China for the health ministry and its allies to get their voices heard. And some of that really, it has to come from the top. It has to come from Xi Jinping and China's other top leaders.
Similarly, Brian asks Buki what the Ministry of Health's influence in the face of billions of in oil revenue is. You know, I guess it's a similar phenomenon.
Yeah. That's been my experience. I mean, the finance ministry and other ministries, or the government is all about the revenue for them, and they will, like I said, it's 80% of the country's revenue. It's been for the past, since oil was discovered in Nigeria in the 60s. And even with so much push to say, okay, you know what, a lot of activities around oil exploration is causing pollution everywhere. In pockets, in states, in many states across Nigeria, pockets of communities, you see where wherever they are exploring oil, the communities, the land has been destroyed, farmlands, beautiful forest and all that just ruined, and all people's livelihoods gone. And you can't even, the air is polluted. We talk about the land being polluted. The air being polluted is actually much more worse, because people are breathing air that's just choking and unhealthy. And because like Jason said, the Ministry of Health can't bite. They have no teeth to bite. And they can't, because they're also spending money, they're not bringing in revenue, even though they are in creative ways. At the end of the day, if you are saving money by keeping your population healthy, I think one way or the other, health is wealth at the end of the day. But my experience has been that the government just doesn't see why this is something they should prioritize. Issues of health, issues of climate change, issues of pollution, not just even oil, plastics, everything is not, the regulation is really lax. And more and more, that's why I think what we do is important. And that's why I agree with Jason that talking about people the traditional way will always get the attention of in our reporting. That's why you just have to keep pushing and knocking, following up on this story. So at least a form of push to hold somebody accountable. I mean, you could even hold the Ministry of Health accountable for not reacting to this sort of situation. That, for instance, in this story that I wrote, it was the Ministry of Environment that should have taken this up on behalf of the people, and they haven't. And just targeting them to say, what have you done on behalf of these people? I think is I just heard yesterday that the Ministry of Environment, they're going to visit that community. They've never been there. They've not been there for 10 years. But because of this story, because I put out a lot of questions and we were keen on just bringing, we knew we were not going to get any response from them. But we wanted it to be on their radar and something that they couldn't deny. We sent forward the test results confirming the contamination and all that. So they didn't give a response to the story, but taking the decision to visit after the story has been published, I think is one way or the other. We can just keep pushing for accountability when we do this sort of story or stories around public health. And that's what story around public health actually achieves, I think.
Yeah, thank you, Buki. Our next question is from Omolola for Mahima. How did you get to speak to women directly without them being chaperoned by their husbands? And what was your experience of reporting victims of trauma and abuse like? And how did you maneuver that during the pandemic?
Right. Thank you for the question. One of the things I learned quite early on while talking to women for other stories was that you don't go to their households and talk to them because their in-laws and their parents or husbands are going to be there and they're going to overhear you, and they don't want them to tell you what their life is like. So for this story, I went through a lot of, we had to set up interviews way in advance, get their consent, let them know that I'll be talking about this. And most of these conversations happened inside hospitals or counseling centers. And this actually kind of really adds weight to what the WHO says, that hospitals are safe spaces for women, survivors of violence. They are the spaces which, these are the spaces which women trust, and the people here are in a position to earn that trust. And so it really kind of helped me. These spaces are where I actually found them trusting me as well, because they felt that I was writing about what healthcare issues they have, rather than just their stories of violence. And they were willing to talk about how they overcame the challenges and the issues in their lives because of the help they received from these hospitals. So I think that helped me. And in the pandemic, it was particularly difficult again. But oftentimes it was again through health workers, grassroots health workers or NGOs that I would approach these women, and oftentimes when their family members were not at home. And I cannot emphasize enough how we need to be extremely careful when talking to survivors of violence, and observe who is watching us when we are talking to them. So I hope that answers your question.
Thank you, Mahima. Our next question is from Solomon, and it's for Buki. How do you select your stories? What are the factors you see that tell you this story is a good one to pursue for your audience? Solomon teaches public health communication at a university and would like to add these ideas to a list they could push to students.
Okay. That's a question that is a really long answer, but I guess I'll say, how do I select stories that I dwell on? I write a lot of stories. Like any reporter in the newsroom, like any editor in the newsroom, you are commissioning stories, you are reporting stories, you are editing. It's day to day or week by week. But I think how I would say how I select the stories I will put more energy on, I'll probably put more resources on, is access. Sometimes, and I'll give an example of this particular story, the story about pollution. Solomon, I'm thinking you're Nigerian. You probably know a little bit about the story. It's a story that I saw, that this is not something just affecting a family, is affecting a huge chunk of people. I had a very close friend who had lived in this place for 2 months, and she had to relocate. She had to leave the place within 2 months because it was affecting her psychologically, it was affecting her financially. And I thought, oh, this is not just a story. This is a story that she's living in a place that is not just her feeling it. Her story is important, but is also as important as what many other people are feeling. And I thought, this is something that, this is a matter of injustice, right? This has been unfair to these people. I think for me, it's also about how I feel a story is going to turn out, or how I feel about the response. If I were writing about this story, if the government was on top of this, if they had provided alternative water sources for these people, if they were in communication with them, I think I would report it out differently. It may just be a feature story, a short 800-word feature story. But this is something that lingered for more than 30 years. This is something that the government was benefiting from. This is a business that they could have paid these people compensation for a very long time. They have the resources, they have the money. This is about 1 million people, your citizens. This is about your bread and butter, and you've absolutely done nothing about it because the government feels if they ignore them for quite some time, they will keep quiet about it. And that's how I sort of settle on. It's always from a personal perspective. Somebody tells me something, and I think that there's a way we can make this matter not just to that one person, but for people to care about it. So I would say that's how I settle on some of the stories I tell. There was another story I did about how sand mining, huge businesses owned by companies exporting sand from Nigeria to Dubai. were harvesting sand from this coastal, very rural, in a slum community that is not even on the map. That's how rural that community was. And they were losing their houses. Houses were falling into water. They mine sand from this community. Then all the houses fall into the water overnight. And they were being harassed. They were not being compensated for this. They were not being relocated. The government was not saying anything about it. And for me, that was another case of injustice. So, and it's not just one person. It's about people living in that area. More and more, I find myself just settling on stories that affect one person, but also has more impacts in a community. And that, I would say, that's how I determine whether this story deserves 6 months or whether this story is just a phone call.
Yeah, and I can follow up on that too. And I think something that all three of our stories have in common is that these are the types of stories that it's hard to get editors to buy into. It's hard to get resources for. And so this is why the Pulitzer Center is really key in helping to provide funding for these types of stories, to talk about gender-based violence in India, to talk about pollution in Nigeria, to talk about smoking in China, right? So this is, I think this is where Pulitzer Center plays a really key role. At the examination, we really focus on, just back to Solomon's question, on these health issues where there is sort of long chains of accountability and they're sort of slow rolling health crises. So that's why we focus on tobacco, on pollution, on big food, because all three of these industries, they have enormous impacts on people's health, but the health effects often aren't felt for years or even decades. And so by its nature, the news industry, it's difficult for editors to buy into stories where the consequences are removed either in time or distance from the people who are consuming the stories. So so that's why I think the nonprofit news model and funding like Pulitzer is very useful for telling these kinds of stories.
Thank you, Jason. We just have one more question that I'd really like to end on, and we can start with you, Mahima. How often do each of you practice solutions journalism when reporting on global health problems? And what are your personal thoughts and reflections on its impact on public policy?
Thank you, Ethan. And I'd just like to add that, Jason, you're absolutely right. It took me more time to convince editors to take the story than the Pulitzer Center. I think I started reporting on this about 1.5 years ago, and it took me less time to convince the center than any of the editors I work with. But I think I'm very happy that they did trust this project. And coming to the question, Ethan, in part, this was a solutions journalism story. Because I was looking at some of the states, because health is a state subject in India, and so gender-based violence as healthcare concern becomes a state issue, which means that very few states have actually taken it up. And I was looking at the states who took up this issue and who tried to train their health systems to respond to gender-based survivors of violence. So it's not there in our health curriculum in our colleges. It's not there in our hospitals. Our doctors are not trained for it. So the whole story, the first story I did, was about what happens when you do train someone to look for gender-based violence, and how does it change the way healthcare is, healthcare access works and how health is delivered. So in part, that was a solutions journalism story, and it kind of also then grew into looking at what the government at the center is not doing, what the other states are not doing, and so on. So I do look at solutions journalism often, but I try to kind of place the solution in the wider context and see whether it's scalable, whether it's effective, whether it's reaching a lot of people or not. And because there is a certain solution which came with the Nirbhaya fund of starting these centers, which were outside the hospital, which did not help the people, which did not have healthcare staff, attached to them. So I think a solution story can also be very critical sometimes. And yeah, so I do look at them.
Thank you all. Unfortunately, we do have to wrap up. It seems like we have another webinar scheduled. I really appreciate your time today, and I really thank you so much for all you've done. Your reporting is wonderful. And I have just a couple of parting words. Jason, that you went off mute. Do you want to say something quickly?
No, I want to thank you, Ethan. I want to thank all the participants and attendees today. Thanks very much for joining us. It's been an honor.